Experts say each day testing for the coronavirus here in the DMV gets better and better. And that's very important because until a vaccine is created, testing is the only line of defense for controlling the spread of the virus. Out of the gate in the United States, testing for the coronavirus was a fiasco. According to University of Maryland pathologist Dr. Christy Johnson, only certain places perform tests.
Where we were just testing in the local public health laboratories across the country.
That test, which involves swabbing 4 inches inside your nostrils, took days to get results.
Since the reference laboratories that first started testing are in California, and we're in Maryland. So that sample has to get to California before it's tested.
In the last few weeks, testing across the country and the DMV streamlined. More hospitals can perform the test and get quick results.
And some of those can be run in 1 to 2 hours.
Why does that help? Well, consider South Korea. When the coronavirus outbreak started there, it spread at levels only seen in China. But within a few weeks, massive testing allowed the country to control the virus through social distancing. Now, South Korea is the model for slowing the spread, and that is what health experts want to do here.
As we are testing and noticing that the virus is still spreading, you can see that there's stricter and stricter regulations.
Those regulations can be more strategic as officials understand where the virus spreads, but it all starts with testing. Dr. Johnson added that in the last few weeks, the University of Maryland has been able to get testing and results at 5 of their hospitals, but that there's still work that needs to be done across the state. In Northwest D.C., I'm Matt Gregory, WUSA 9.